Micardis or Telmisartan also offers protection beyond blood pressure control. Is Micardis a good blood pressure medication? Absolutely. Does Micardis help with systolic, diastolic hypertension? Absolutely. Is it also effective in isolated systolic hypertension? Yes, absolutely. But Micardis also gives you protection beyond just blood pressure. There's a recent study that came out, and a really exciting study that involved 25,000 people from across the world. All ethnic groups were included, 40 countries. This is a global landmark study. This is one of the biggest blood pressure studies. Actually, it wasn't a blood pressure study. It was beyond blood pressure. It was a cardiovascular protection study, because everybody in that study either had a stroke, either had cardiovascular disease like heart attack or heart disease or peripheral artery disease or diabetes with end organ damage, and they had to be 55 years or older. And all of these people were either on blood pressure medication, on cholesterol medications, they were on aspirin. And what they were randomized, or they were put in 3 different channels. One channel was using ramipril or Altase. The other channel was just using Micardis. And the third channel was a combination of the both. And the reason that Micardis was used against Altase, because Altase has been shown through the HOPE study to decrease cardiovascular events, the second events of heart attacks or strokes, by 20%, which is huge. So that decreases by 1 in 5 your chance of having another heart attack or stroke. So what they said, well, right now the gold standard is Altase. Is Micardis as good? So they did this study, and a lot of studies run for 6 months, a year, 2 years. This study ran for 5.5 years. And the end point of the study was whether you had a heart attack, whether you had a stroke, whether you were hospitalized for cardiac or cardiovascular type diseases. Well, what they found was that Micardis was as good as ramipril for cardiovascular protection. So the takeaway message from this is that if you want great blood pressure control, and if you want cardiovascular protection that goes beyond blood pressure control, the medication to take is Micardis.